Welcome to today's webinar, Sleep and Aging with Dr. Michael Breus, also known as the Sleep Doctor. I'm your host, Janet Barker Evans. According to the Sleep Foundation, people over 60 are more susceptible to insomnia. In this webinar, we'll discuss why, how your sleep can change as you age, and what lifestyle and routine changes may help you get more quality Z's. Let's jump in and meet our speaker, Dr. Michael Breus. Dr. Breus, PhD, is a double board certified clinical psychologist and clinical sleep specialist. He's one of only 168 psychologists in the world to have taken and passed the sleep medicine boards without going to medical school. Dr. Breus is the author of 4 books, including his latest book, Energize, Go From Dragging Ass to Kicking It in 30 Days, which was named one of the top books of 2021 by the Today Show. He's an expert resource for most major publications, doing more than 400 interviews a year with Oprah, Dr. Oz, the doctors, the New York Times, and the Wall Street Journal. Dr. Breus has been in private practice for 23 years and was named the top sleep doctor of Los Angeles by Reader's Digest. Welcome, Dr. Breus.
Thanks, Janet. I really appreciate that awesome introduction. So first of all, thanks everybody for coming out and wanting to learn more about your sleep. I want to excuse my background. I'm in a hotel room here in New York City. I was just on live with Kelly and Ryan, and that will be airing tomorrow. So if you get an opportunity, you can see my ugly mug on Kelly and Ryan for sure tomorrow, talking more about sleep tips. This is National Sleep Awareness Week, so it's very apropos that we're here and talking about sleep today. I'm just going to go ahead and launch on in. So one of the top questions that I'm asked is, Dr. Breus, why the heck do we sleep? Right? It's an interesting question, and we know that sleep does a lot of things for both your body and your brain, and we a lot of times consider sleep to be recovery. Remember, a good night's sleep helps your body in a ton of different ways, repairing and regrowing cells that may have gotten damaged or lost the previous day, strengthening that immune system. I'd say during these times lately, having a strong immune system can certainly be an advantage. Repairing those muscles for tissue growth, also producing your body's vital hormones. As we get older, this starts to slow down a bit. So getting good sleep helps keep you back up to where you want to be. Of course, keeping your brain healthy and emotional well-being. And this also, believe it or not, sleep will regulate your mood, your appetite, even your libido. Now, one way to look at sleep is to understand, well, I get it, Michael, it does a lot of good things for me, but what happens if I don't sleep? What kind of bad stuff is going to occur? Well, there's actually quite a bit of science that can help us with understanding this, right? So number one, lots of stuff going on in your brain. You're irritable, you become cognitively impaired, your memory isn't so hot, decreased creativity, increased stress, even lack of focus. This is all comes directly from sleep deprivation. We know it affects your heart. We see increased heart rate variability. We see risk of heart disease. We see risk of stroke. Believe it or not, in your gut, it's actually affected as well. We see an impaired immune system, which is, by the way, the gut is where we see a lot of these things propagate from to help us with our immune system. And then finally, even in our muscles, we see increased reaction time. So you do things slower, decreased accuracy, tremors, even aches and pains. And so one of the things I tell people all the time is literally everything you do better with a good night's sleep. Now, that being said, how does sleep actually work in the body and the brain is kind of another question, or what's my recommendation for getting sleep cycles, things of that nature. So I'm going to ask you to go back into a time machine for a second and go back to your high school biology class, okay? That's probably the last time anybody has talked to you about something along these lines. I'm going to give you a nice, real quick primer so that you can understand exactly how sleep works in the brain. We're going to go over the sleep stages, even sleep cycles. So one of the things we know is that sleep occurs based on 2 separate systems in the brain. One we call your sleep drive, the other we call your sleep rhythm. These are both actually a lot like hunger. So as an example, I'm hungry, I eat something and that hunger begins to dissipate. The same holds true with sleep. When a cell eats a piece of glucose, something comes out the back end. One of those things is called adenosine. Adenosine works its way through your system and then goes to a very specific receptor area in your brain. As adenosine accumulates, you get sleepier and sleepier and sleepier. But that's not the only way that sleep goes on, because that's what puts you to sleep. What keeps you asleep is something called your circadian rhythm. This is also, believe it or not, a lot like hunger. Ever notice that you get hungry around breakfast time, around lunchtime, and around dinner time? Same holds true with sleep. Most people, at least here in North America, have a tendency to want to go to bed somewhere between 10 and 11 o'clock at night. So when your sleep drive is high and your circadian rhythm is in sync, you sleep. But if either one of them is off, that's when you have a sleep disorder, or what I call disordered sleep. Now, breaking this down even further, you may have learned, again, way back in the day, about these things called sleep cycles and these things called sleep stages. So the graph here to the left is what's called a hypnogram. So this is a representation of sleep across an entire evening. The orange that you see all the way to the left is when somebody is awake. Then they go down into light sleep, that's represented by the gray. Then they go into deep sleep, which is represented by the dark blue. They then go back into the gray and then on into the light blue, which is REM sleep. I know I threw a lot at you right there. I'm going to break it all down in just a second. But one thing to notice is that this little dance maneuver I just talked about, that's really a sleep cycle. The way we count sleep cycles is based on number of REM periods. Again, REM is in the light blue here. So we can tell people that it's 1, 2, 3, 4, 5 cycles. I want you to lock that number into your head, because that's the appropriate number of cycles for most adults. 5 cycles. People also kind of like to know, well, Michael, how long is a cycle, right? Average cycle is anywhere from 80 to 120 minutes, with 90 minutes really being the average that we see. Now, a few other things I want you to notice about this slide. You might notice that deep sleep, that's again represented by the dark blue, is front loaded. Seems to be mostly in the first third of the night. That's an important thing to remember as well. While REM sleep is spread out a little bit more across, with most of it happening in the last half of the night. Whoever invented sleep up there may have had some interesting ideas, but what it appears as though it's doing is it's taking care of one part of the body first and then a second part of the body next. Let me show you. So when we look at these stages of sleep, right, this is again here represented by the deep blue. These stages of sleep, this is your physical restoration. This is the wake up and feel great sleep, right? Your blood pressure drops, respiration slows, something called growth hormone is emitted. Now, for folks who don't remember, growth hormone is kind of like the holy grail of longevity. The more growth hormone you've got in your body, it means the more killer T cells that are being produced for your immune system. It also means that your muscles are getting more repaired. It means your brain is functioning better. We want as much stage 3, 4 sleep as we can possibly get. Okay. And this is again, mostly during the first third of the night. The second big phase of sleep that I like to talk about is REM sleep, again, represented by the light blue spread out a little bit more across the evening. That is your mental restoration. So stage 3, 4, otherwise known as deep sleep, is physical restoration. REM sleep, known as mental restoration. Now, this is where it gets really interesting. The data that we've just recently looked at shows that this is where you take information and move it from your short-term memory to your long-term memory. Your brain creates like an organizational substructure, kind of like a filing cabinet. So when you're wandering around throughout the day, you're getting data all the time, coming in through your eyes, through your nose, through your ears, through your mouth. And there are things that you want to kind of store to be able to retrieve later on. Like, hey, where's my favorite pizza place? Or do I really like that kind of coffee? Things of that nature can be important to things to remember. All of that occurs during REM sleep. Now, that process of moving information from short-term to long-term, that's what we think dreaming actually is. Now, you might turn to me and say, well, hold on a second, Michael. Dreams are kind of weird. I have all kinds of strange things that happen in my dreams all the time. That's actually okay. Here's what we know about dreaming is all of this information comes through the door. And let's say you had a dream where you walked into your kitchen and your dog is sitting at the kitchen table eating a bowl of spaghetti with your second grade teacher. Now, that's a weird one for sure, but here's what's probably going on. Is you might have had Italian for dinner, your dog might have jumped on your bed, and your second grader might have said something to you at some point in time throughout the day that you wanted to remember. But it all kind of gets congealed into this idea of the dog eating spaghetti with your second grade teacher. Don't worry, it all kind of straightens itself out in the end, but it's a weird kind of scenario that's going on inside your head. Now, I'm going to digress here for a second, and I'm going to tell people a few other things that happen during REM sleep, which is really interesting. One of the biggest is that your muscles become incredibly relaxed. Now, this is the point in the lecture that I usually say, by a raise of hands, does anybody out there know why we become so relaxed that we become paralyzed? Don't worry. You don't have to answer the question. I'm going to answer it for you. So this is where the reason that we don't have any what's called atonia or muscle movement is so that we don't act out our dreams, right? Kind of crazy, right? You wouldn't want to be acting out your dreams. You could get hurt. You could hurt somebody else. Something could be going on. I'm going to tell you a story about a patient that I have that actually had this problem where he acted out his dreams. So I'm originally from a small area outside of Atlanta, Georgia, called Sandy Springs, Georgia. And in Sandy Springs, Georgia, we have a decent sized hunting community. And if you're a hunter and you shoot a doe and you don't kill it, you either have to go over and slit its throat or crack its neck. It's the most humane thing to do. This gentleman who I was treating, who was a hunter, woke up one night with his wife's head ready to crack her neck. Okay, no joke. You can't make this stuff up. It was pretty crazy. So the first question I usually get is, did he kill her? Good news here. No lives have been spared for me to have this lecture with you guys. She is alive and well. Second question I always get asked, are they still married? Got to be honest with you. She's a patient woman and she was able to wait for us to help treat him. No harm was done to her and they are happily married. So what's fascinating here about this case is this is something called REM behavior disorder. Again, this is the acting out of the dreams. Believe it or not, one medication called Klonopin, about 0.5 milligram, silences that behavior quite quickly. However, I use this as an example of something that I believe is more important, which is sleep really is a window into our overall health. People with REM behavior disorder, roughly 35% of them, the RBD is a precursor for Parkinson's syndrome. Yep, a big one. So if you're somebody who's acting out your dreams or your partner is acting out your dreams, it makes a lot of sense to talk to a neurologist because that could be very, very helpful. With the gentleman that I described, turns out that he was a Parkinson's patient. He didn't know it yet. And we were able to put him into treatment 10 years before any Parkinsonian-like symptomatology erupted. And we were able to change the course of his disease. So if the thing I guess I'm trying to tell everybody here is if your sleep is messed up, there's a reason. Okay, it's usually due to something else going on from the health perspective of your body. We're going to get into that in just a second as well. Now, another popular question that I get asked now that you've got this head full of information, you understand how sleep works is, all right, Dr. Breus, I get it. It's important, but how much sleep at night is good for good night's sleep? And how many hours of sleep would I necessarily need based on my age? Again, great question. So what I did here was I've got a graphic which tells us a whole lot about different types of sleep. Now you might be saying, Michael, we're a community that doesn't have, 6-year-olds and 10-year-olds and things like that, but you do have children and you do have grandchildren. And so this is important information for you to understand to maybe relay on to your children about their grandchildren as well. Itty bitty babies, 12 to 18 hours of sleep. Moving forward, we see that number shrinks and shrinks and shrinks. When you get to the teenage years, which I would argue would be 11 to 17, that's the second to last one on the right-hand side. This is really where we see a lot of sleep deprivation hit. These kids are needing somewhere between 8.5 and 9.5 hours. And here's the sad part is we now know they only get about 7.5, right? Due to school commitments, sports, drama, music, whatever the activity it is. A lot of people are waking up really early to do it or staying really late and not going to bed. As you'll notice all the way to the right, 18-year-olds and above, which are considered adults, there's a range of between 7 and 9 hours of sleep. Now, let's also be fair. We're going to talk a lot more now about what happens during that aging period and how you need different types of sleep.
That's great. I was just going to say that's 18 plus is a broad range. So
Yeah.
I have to believe that something different happens when you hit 40, 50, 60.
Absolutely, it does. Thanks for the comment. And we're going to be talking about that in just a few moments. So what happens to the sleep as we age? Well, we're going to take a look at it. These are the questions that I'm going to attempt to answer for you today. So how does sleep change as we age? Do we need less sleep as we get older? This is something that a lot of people wonder. Can a person expect to experience more sleep problems or have a sleep disorder as they advance in age? As we age, how does sleep affect our overall health, medical conditions, and general well-being? And what do we do to get good sleep, Dr. Breus? We're going to address all of these in short fashion. So when we look at sleep, especially in the 50, 55 plus age range, that's me, I just turned 55 this year. One of the things we know is, in fact, there are 3 separate conditions that have a huge effect. One, your hormones change. This is not new news to any female that's in the crowd right now, right? You're already dealing with hormones on a menstrual cycle basis, but when you hit menopause, the world goes cuckoo when it comes to your hormones, that's for sure. We know that this has a dramatic effect on your overall sleep. Second thing, physiological conditions. Let's be fair, as we get older, things break. Things don't work as well. We get into situations where we may have high blood pressure. We may have different problems with testosterone. The list goes on and on and on. So lots of physiological conditions can definitely have an effect. Pain is another big one. We experience far more pain in our later years than we ever did in our early years. This is one of the reasons why I like to highlight environmental conditions, because there's not a lot you can do to change your hormonal changes, and there's not a lot you can do usually to change your physiological changes, but there's a lot you can do to make your environment much better for sleep. There are really 3 areas that we want to take a look at: light, noise, and temperature. We want there to be as little light as possible. Now, I want to be clear, if there's a little blue light on your VCR, I don't think I care about that, okay? I'm talking about overhead light or lamps by the bedside light. Noise turns out to be a big one, and this can be a challenge, right? Because some of us sleep next to something that snores, right? Now, that might be a bed partner, that might be a puppy dog, never quite know, but noise absolutely, positively can have an effect on your sleep. But the biggest one by far is temperature. This really has an effect on this population of people for 2 specific reasons. One is our ability to regulate temperature as we get older is a little bit more difficult. But number 2, we lose a lot of weight, specifically the fat in our skin. And so as we get older, you'll notice that it's difficult to pinch much fat underneath your skin. That's called subcutaneous fat, and I call it insulation. Right. And so here's the problem is when that thins out, we get cold easier, we get hot easier. And so regulating that temperature can definitely be a challenge, but something that is definitely worthwhile for you to try to do. Keeping all of this in mind, when we look at how do we sleep over a lifetime, this graph gives us a really good understanding. So if you look all the way to the left, you'll notice that the boxes represent men and the circles represent women. So the first boxes all the way to the left are people who are age 10, and their sleep efficiency is marvelous. Man, I wish I had sleep efficiency that looked this good. Now, sleep efficiency, again, is a measure of how much time in bed do you actually spend asleep. Meaning, are you waking up in the middle of the night? Do you have multiple awakenings? Is it difficult for you to fall asleep? For 10-year-olds, no go. They are doing great. Basically, their head hits the pillow and boom, they are out. Now, if you start to cross the chasm here and start to look at sleep in your 50s, in your 60s, and in your 70s, you'll notice that the curve is not going in the direction that we want it to. It is actually going down, which means we do have far more disruptions as we get older. Once again, this is a reason why we want to pay strict attention to our environment and our physiological conditions, because all of those are working against us when it comes to sleep as we age. I thought what I would do here is show you, remember that hypnogram that we saw in the very beginning? I wanted to show you what this looks like from somebody as we get older. So the bottom graph is somebody who's 65, and the top graph is somebody who's 35. So one of the things I like people to notice is you see where it says awake on the top. Every time the bar reaches that part, that's where somebody wakes up. So on the 35-year-old, which is again the graph on the top, you'll see they woke up 1, 2 times. But on the 65-year-old on the bottom, you see they woke up 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 times. Let's be fair. If you woke up 10 times, you probably wouldn't feel so hot, would you, right? This is what's going on an average basis as we get older. Now, what are the sleep changes? Well, we know that we have more fragmented sleep. That means interruptions throughout our sleeping period. I just showed you some graphs to look at that. But we also see that our slow wave sleep, remember that's that physical restoration, that wake up and feel great sleep, begins to reduce as well. In 2003, the Sleep in America poll actually did a great job where they started surveying people in this age range and trying to understand a little bit more about what's going on with their sleep. 2/3, that's 2 out of every 3 people reported experiencing 1 or more symptoms of a sleep problem, at least a few, meaning 3 nights per week. So this is not good, guys. This is not the way we want to be going into the years of our life. We want to be alert and alive and ready to go. And what we're seeing based on this poll is it's not necessarily the case. Don't worry, there's things we can do to fix this. I'm not all about doom and gloom. I've got some great tips for us at the end as well. I mentioned slow wave sleep seems to become less powerful. I thought I would give you an example of what that is. So this is actually an EEG waveform of slow wave sleep. You can see on the top, we've got our 15-year-old male. The waves are humongous. They're nice and wide. They look beautiful. I mean, honestly, if I wish I had delta waves that look like this. Now, the second one is we see in a well-preserved 65-year-old male. Now, you'll notice a few things about this. Now, they're not as tall. So the amplitude, that's what we call it, of the waveforms has begun to shrunk. And the width has kind of started to come in a little bit. Now, here's the one that's really we're worried about is this final one. These waves are very small, only 2 boxes big. By the way, this is a scale. So if you look at the boxes on the top one, it's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 boxes in height versus 2 boxes of the not well-preserved older male. So again, this is what we all have to experience and look forward to. So when we go back to the sleep and aging poll, here's what they discovered, right? Poll found that the better health of older adults they were more likely to sleep well. The greater number of diagnosed medical conditions, the more likely they are to report sleep problems. Staying healthy gives you better sleep. Bottom line, right? Believe it or not, positive mood and outlook, as well as having a more active and engaged lifestyle, are associated with getting 7 to 9 hours of sleep with fewer sleep complaints. So here's the good news. It's about positivity. It's about activity, right? It's about engagement. It's about making new friends, going to the movies, listening to a lecture with people. It's about being out and about, walking from place to place instead of riding, if you're mobile enough to do something like that. But the more active you are and the more positive you are, the fewer sleep problems you're going to have. Now, one thing that a lot of people don't understand, and I put this in red as a big red flag for people to understand this, but it appears as though that rather than a consequence of aging, poor sleep among older Americans appears to be an indicator of health status. So remember the case I was telling you about my gentleman with REM behavior disorder, where we said sleep is a window into something going on with him. And for him, it was Parkinson's syndrome. This is what I want to tell you. Not that everybody out there is going to get Parkinson's, because that's not the case. But what I can tell you is if your sleep is kind of messed up, there's something else going on. I can assure you of that. And it's worth addressing. You could have a sleep disorder or something else that's happening that you've kind of been ignoring and not wanting to talk with your doctor about. So in summary, what have we learned about sleep as we age? Well, sleeping during the night changes that happen with increase in age. We have less deep sleep, more lighter sleep. That's no fun. We have more difficulty maintaining sleep due to these arousals and awakenings, and our sleep is more fragmented and less efficient. Another big thing that happens, we want to go to bed earlier. You ever notice how when you're talking to your kids or your grandkids and you invite them over for dinner and they say, let's have dinner at 7:30, 8 o'clock. And that seems like there's no universe where I want to have dinner at 5, right? That's not your fault. Believe it or not, that's your biology talking. So remember in the very first slide when we were talking about drive versus rhythm, your circadian rhythm is going backwards in a sense as you get older. I mean, honestly, I personally love having dinner at 5 o'clock in the afternoon. It works for me, right? That's when I'm hungry because my circadian rhythm seems to be marching a bit backwards. Older people also experience higher prevalence of medical conditions, and they take medications that can interrupt or associated with sleep problems. So you might be doing the right thing by taking your medications, but if you haven't talked with your doctor, you might learn that some of your medications could be affecting your sleep. I want to be super duper clear about this. Do not stop taking your medications, okay? That is a conversation between you and your doctor. But what I will tell you to do is if you're kind of getting crappy sleep and you started a new medication, tell your doctor, because they might be able to change the dosage, change the timing, even change the medication for something that works better for you and your sleep. Older people have a tendency to experience a higher prevalence of sleep disorders as well. Now, what are some of the signs and symptoms of sleep issues? Well, this is kind of interesting. Disrupted breathing for up to a minute at a time, excessive sleepiness during the day, irritability, chronic snoring, even gasping upon awakening. Medical conditions that are linked to sleep disorders, I'm going to give you a huge list in a second, but literally all of these on the right-hand side have something to do with or are linked to sleep disorders. Now, you might be saying, okay, Michael, I think I could have a sleep disorder. I mean, some of those symptoms you said, I think I have a couple of those. Like, what happens next? So if you actually want to get diagnosed, which you do if you have one, what is the process or procedure that you're about to embark on? This is called full nighttime polysomnography, otherwise known as a sleep test. Now, you see the gentleman all the way to the right. He has 27 electrodes attached to his head, over his body, things like that. Young child, we see, and by the way, we can do sleep studies on infants, so it's not necessarily a problem. Now, you notice here the lady to the left. She is fully ready for a sleep study. 27 electrodes, 2 respiratory belts, all these wires. As we like to say, she's wired for sound. Most people say, Michael, how does anybody fall asleep with all that gunk and gook all over them? I'm here to tell you, usually people are so damn tired. Once we get that on, they fall asleep in the chair. So it really isn't usually a problem. But that being said, it's not the most comfortable environment, and it's certainly not like an environment that you would normally have. So what they've invented over the last 10 years are home-based sleep studies. That is the 2 pictures that you see to the right. The gentleman's got something going across his chest. The other one has something on his head. There are various different apparatus that can be used now to be able to discover if you have a sleep disorder. Now, what could you expect if you go to a sleep lab? Well, you're going to probably get wired up. But a few other things to think about here is you're going to arrive somewhere between 8 and 9 o'clock at night. You'll be oriented by somebody who's called a sleep technologist. This is a person who will put on the wires and watch you throughout the entire evening. Most of the time, these are registered polysomnographic technologists, so they have a degree, they know what they're doing, and they can handle emergent situations should one arise. To be clear, I've worked in sleep labs all over the world. I've never had anybody go into an emergent situation during a sleep study. So it's not really something that happens often, but we train in case it does. For some people, we might even fit them for something called a CPAP mask. So if you do have something called sleep apnea, which we're going to talk about in a minute, the #1 treatment is a mask. I'm going to show you why and how it works. But before the whole study begins, they'll want to make sure that they've got one that fits for your face, because you really don't want to do it at 2 o'clock in the morning. There's some quiet time after you set up. There's lights out between 10 and 11, and then you may have a CPAP trial in the middle of the night. Usually you're woken up somewhere between 6 and 8 o'clock in the morning. And let me tell you something, you're ready to get out of there. Most people tell me this was a terrible night's sleep. I don't think it was representative of what's going on with me. Don't worry. We catch the data. We know exactly what we're looking for, and we can give highly accurate diagnoses. Now, that's for an in-lab sleep study. But Michael, I don't want an in-lab one. I want it to come to my house. Well, this is a lot better. I'll tell you that. But I will also let you know it's not as accurate. It's great for sleep apnea, but if you think you have something called restless leg syndrome, periodic limb movements, or narcolepsy, you're actually going to be better off doing an in-lab study. But remember, the most popular sleep disorder turns out to be sleep apnea. What's nice about these home studies is it's performed in a comfortable, familiar environment. There's no invasion of your privacy, and it's a much more realistic assessment of your sleep. So what are we looking for? The biggie, sleep apnea. Crazy numbers here, but 18%. That's like 1 in every 5 men have undiagnosed sleep apnea. So look to your right, look to your left, count off, in fives, somebody there is probably got it. Turns out there's two types. There's obstructive sleep apnea. This is where there's a blockage in your throat. Maybe you have a big tongue and it falls to the back of your throat. Maybe you got big tonsils, adenoids. Usually it's an anatomical issue that's been going on for quite a while. Central sleep apnea is quite different. That's where your brain tells your lungs don't breathe. That is a much more serious situation, not easy to treat at all. To be honest, you don't want to have sleep apnea. Now, I'm sorry, central sleep apnea. Now, is it treatable? You bet. Do we have great methods of treatment? We do. It's just a lot more complicated than your run-of-the-mill, if you will, obstructive sleep apnea. This is one of the more interesting slides, I think, because a lot of people don't understand how often sleep apnea is comorbid with another situation. Before, when we were doing our tech check and I was talking with all the people that have been so helpful, they were like, Michael, these numbers are insane. A couple to bring out in front of you. One of them is second one down, drug-resistant hypertension. So this is high blood pressure that's not being responsive to medication. That is an extremely dangerous situation. 83%. I mean, 8 out of 10 people have undiagnosed sleep apnea. Once we fix it, by the way, that number dumps to about 30 or 25. So we get a whole bunch of people a lot better just by treating their sleep apnea. Other ones that I thought were interesting of note, congestive heart failure. In an older demographic, we see a lot of CHF. 85% of those people have got sleep apnea. And if it's left untreated, it just makes the CHF worse and worse and worse. The biggest number on here, stroke. 92% of people who have a stroke have sleep apnea. Because remember, when you stop breathing, your oxygen drops. When your oxygen drops, you can pull off an aneurysm very, very quickly. So again, if you or your bed partner or you have a suspicion that you're not breathing in your sleep, if you wake up with a headache in the morning, if you wake up groggy and never feeling quite awake, talk to your doctor. You may have undiagnosed sleep apnea, and it could be making your other situations kind of worse. Type 2 diabetes is another one. And even people with weight issues like obesity, that's a whole nother issue that we have a tendency to see. But once we treat it, everything seems to get better. Now, what are the signs and symptoms? Well, I've mentioned a few, but I figured I'd give you a pretty big list here for you to look through. And again, if you check off more than 2 or 3 of these symptoms, you probably want to talk with your doctor. Now, I want to be clear. Lots of people snore, but not everybody that snores has sleep apnea. However, if you snore or your bed partner tells you that you snore and you stop for brief periods of time and then you make some kind of noise and then you kick back in, that's sleep apnea, I can assure you. So you really want to understand what's going on. Do some people just snore? Of course they do. But here's the way it works. 90% of people with sleep apnea snore. Only 50% of people who snore have sleep apnea. So it's a two-way street, but the traffic is different going the particular way that you are. Of course, if somebody notices you stopping breathing even once, you probably got it quite a few times. Most people wake up with a dry mouth in the morning, headaches, fatigue. A lot of people have car accidents. They fall asleep at a stoplight, and that's what really brings them in. Even things on the mental health side, like irritability, depression, there's also leg jerks that occur at night, having to get up and use the restroom multiple times, night sweats. I mean, honestly, guys, the list goes on and this is just for sleep apnea. So once again, if this is something that you are suffering from, at least 2 of these, it's probably worthwhile talking to your doctor to see, hey, maybe I need a home sleep test. I thought I would show you the real science behind it all, so you could see the things that I look at in order to determine, does somebody actually have sleep apnea? This is somebody with 27 electrodes attached to their body. The first top 2 have to do with their eyes. The next 4 have to do with their brain. Then it's their chin, then their legs, then their heart, then their breathing, and then their oxygen all the way at the bottom. So things to look at. So number 1, you see a great big blue arrow right in the center, and you see something that says apnea. You'll notice that before that green, it was nice and flowy, and then all of a sudden, boom, flat line. Pretty much in medicine, anytime you see a flat line, it's no bueno, if you know what I'm saying. So Here we see a complete flat line, meaning complete stopping of breathing. Then we sort of see a snort and an arousal. Now, if you go down to the bottom, here's where we see the real damage being done. Is in the middle of that apnea, their oxygen level was at 94%, but just afterwards, look, it drops all the way down to 89%. We really don't like to see people's oxygen drop below 90 ever. It is not a good place to be. Also, if you're 55 and older, you might only be at like 91, 92. So it's very easy to drop below there, have a stroke, have a heart attack, things of that nature. I'm not suggesting that everybody out there who has this happen is going to have a stroke or a heart attack, but I'm going to tell you something. You're a heck of a lot more likely to do so if you don't get this treated. What are the different ways to treat sleep apnea? Weight loss is definitely an option. A lot of people say, oh, I'm not interested. I'm fine the way I am. You're not. Okay, I'm here to tell you, if you've got extra weight on you, it is probably doing multiple things, not just sleep apnea, but diabetes. There's a whole host of different things that all that excess weight can be doing. Now, there's some easy treatments, which is some people only have sleep apnea when they're on their back, believe it or not. So what do? We rotate them and we put them on their side. Everything seems to be working just fine. I'll be honest with you, that's only in about 8 to 10% of the total cases of sleep apnea do we have that luxury. Most people end up on something called positive airway pressure. So if you look to the right, you'll see a mask that this person is wearing on their face. That is called a CPAP, which stands for continuous positive airway pressure. So basically it's a hair dryer blowing up your nose. And when it hits that area that's kind of collapsed, it ever so slightly opens it up, shoots air straight to your lungs. Now you're probably thinking, dude, there's no universe where I'm going to fall asleep with that on my face, right? I get it. So here's what I did. I decided if I'm going to prescribe these things, I better try it out myself. And I don't even have apnea. It took me the better part of 3 weeks trying every single night until I was able to sleep through the entire night with it on. But I adapted. Okay. And here's the big thing that I tell all my friends who go on these CPAPs, because I treat a lot of my friends these days, is I say, look, they say, oh, it's not sexy. Oh, I don't like it. It's not fun. Oh, I have to clean it. I said, well, what's your alternative? You can be sleepy all day and you can die earlier. That's the bottom line. I'm not trying to scare you. I'm just trying to tell you the truth here is if you don't treat sleep apnea, your mortality goes up dramatically. There are other options too. There are these things called dental appliances. You'll see in the picture to the lower right. This will slightly move your jaw forward, thereby opening up your posterior airway space. There are also surgical interventions if you have really severe apnea. And for some people, just plain old oxygen therapy can actually work out quite well. So there's a list of a lot of different things that you might be able to utilize to be able to help you with sleep apnea. Now, a lot of people are like, well, Michael, how does that damn CPAP thing work? So when we look to the left, we see somebody who has an occluded airway. So you'll notice here, the tongue is all the way to the back, and there's a tiny sliver of dark, which is what air has to go through. On the picture on the right, that's with the CPAP mask on it. Those little pluses represents air. And what do you see? That whole airway begins to open up, shooting air straight down to the lungs. So it goes from that to that. Very, very interesting, happens almost immediately. By the way, this is why CPAP is 99% effective. There ain't a whole lot of treatments in this universe that are 99% effective. Another way to look at this is to actually look at the volume of your esophagus through MRI. So I have some kind of interesting pictures here. You'll notice on the left-hand side, this is somebody at a pressure of 0. All the way to the right-hand side is a pressure of 15. Notice the width is dramatically different. This allows, again, for more air to go in. And at the end of the day, we like it when our patients breathe. Now, another big concern or thought is, what about sleep and the risk of Alzheimer's disease? I know this is something that's heavy on lots of people's mind, and I'm here to tell you there is definitely a relationship here. So what's interesting is scientists have recently discovered that there are several types, 2 specific types of protein that appear to degrade brain cells, leading to more serious problems like memory, learning, and mood behaviors, which are the hallmark symptoms of Alzheimer's disease. These 2 proteins are something called beta amyloid. This forms a buildup of plaque inside your brain, and something called tau. Tau isn't a globby kind of plaque. It's got these tendrils. And what happens is they wrap around the nerve and they strangle the nerve. And that's where you get some of these memory problems. But both of them are definitely there when it comes to Alzheimer's disease. But what does this have to do with sleep? Well, over a 7-year period, scientists looked at patients' beta amyloid using PET scans, so brain scans. And here's what they found. People with excessive daytime sleepiness, so that's I can barely keep my head up, I wake up and I feel like crap, that kind of stuff, were more likely to have higher levels of beta amyloid over time. So we're starting to get a clue here. When these things accumulate, it ain't good, right? Then what they decided to do was the Mayo Clinic and Madison, Wisconsin researchers said, we want to figure out, is there a relationship here? Here's what they discovered. People who experience excessive daytime sleepiness show more markers for the beta amyloid protein. They also found that daytime sleepiness was linked to more markers for the tau protein. So it's not just beta now, it's tau as well. Okay, Michael, what does that mean? Well, here's where we're understanding more and more about how good sleep can help you reverse this process. Just a few years ago, scientists discovered a previously unidentified system in the brain that kind of clears out the waste. I call it the waste management system of the brain. You know those big trucks that come along and they take your garbage, throw it over the top? There's actually something like that in your brain, and it's called the glymphatic system. When we sleep, the scientists discovered that the glymphatic system becomes 10 times more active when we're clearing waste from the brain. But here's the deal. It only seems to work during, you guessed it, stage 3-4 sleep. Remember stage 3-4 sleep that we talked about earlier in the discussion? Remember how we're naturally getting less and less of that the more we go? So this is why we start to see this progression to Alzheimer's as we age. When you sleep, scientists now think your glymphatic system steps up its activity to remove all of that waste. So if you sleep poorly or you go without sufficient sleep on a regular basis, you're missing out on the full effects of this cleaning process, meaning they leave junk behind, right? And there's only so much that they can clean. And so what ends up happening is you just end up piling up with more and more gunk, which is strangling those nerves and making it difficult for you. Now, I'm not all about doom and gloom. So what I've done is I put together a how to get a better night's sleep protocol, and it's 5 easy steps. And by the way, won't cost you a dime, all right? So listen up, it's gonna make a lot of sense. Step number 1 is to select one wake-up time and stick to it. You notice I didn't say bedtime, I said wake-up time. If 4:30 is your optimal wake-up time and that's when you naturally wake up, I don't think I care. Don't stay in bed and wander around and sit there for hours on end. It's not gonna do you a whole lot of good. Pick a wake-up time, be consistent 7 days a week. Do not sleep in on certain days. Always wake up at the same time. This helps keep your circadian rhythm going the way we want it to, and it helps you have high amounts of deep sleep, which is that thing that we're worried about. Step number 2, stop caffeine by 2 p.m. I know this is a tough one for a lot of folks out there, right? Caffeine has been your friend for a very long time, but people don't realize it, but caffeine has a half-life of between 6 and 8 hours. So if you stop at 2, 8 hours later, 50% of that caffeine is still wandering around inside your brain. Look, guys, if you think you got crappy, sleep as it is because you're getting older, pour some caffeine on the fire and it's going to make it even worse. So please, please, please start to limit caffeine at the very latest by 2 p.m. I want to be clear though, don't go cold turkey off your caffeine, especially if you're like a 4, 5, 6 cup a day drinker. I've had 2 patients end up in the ER because they just cold turkey their caffeine. Slowly infuse decaf and then slowly reduce the amount. That's usually the best way to go about doing it, and talk with your doctor. Step number 3, and this one's not as much fun, is you've got to talk about the booze, right? There's a really big difference between going to sleep and passing out, okay? We don't like the passing out, we like the going to bed. I love an adult beverage with my meal, a glass of wine, maybe even a whiskey afterwards, but you got to limit it to 2, and you need to stop drinking 3 hours before bed. It takes the average human approximately 1 hour to digest one alcoholic beverage. When you hit my age 55, it can take a little bit longer. So do yourself a favor, have 2 glasses at the most, and do yourself a favor and stop drinking 3 hours before your bedtime. I promise you, your sleep will thank you in the morning for sure. Step number 4 has to do with exercise. If there's one way to improve your overall sleep quality, it's with daily exercise. But you don't have to run a marathon, okay? I'm talking 20 minutes of cardio, and it doesn't even have to be all that vigorous. Walking at the mall is perfectly fine, or park your car at the end of the parking lot, walk in when you get your groceries. Whatever it is, but having some level of activity every single day, I'm talking 25 minutes, is going to be very, very helpful. But you don't want to do it too close to bedtime. Like if you forgot to get your steps in, you don't want to go onto the treadmill at 10 o'clock at night. Why? Because it raises your core body temperature, and that makes it very difficult to fall asleep. Remember, in my fourth slide, temperature is a big factor. So do yourself the favor and exercise in the daytime. Also, this speaks to the idea of being active, right? And being positive, both of which are going to be very, very helpful for you in the long run. And step number 5 is to get 15 minutes of sunlight every day. Now you might be saying, okay, here comes the woo-woo California doctor telling me I'm supposed to stand outside in the sunshine. I got some real science behind it for you. So it turns out that when sunlight hits your eyeball, you have a special cell in your eye called a melanopsin cell. And this turns off the melatonin faucet in your brain. It's kind of hard to wake up when melatonin is going in your head. And so this is a great way to walk outside, get some fresh air. And by the way, 15 minutes is the exact amount of time you need to produce vitamin D. Vitamin D turns out to be a circadian pacemaker and is very important in our fight against COVID. So for folks out there, you need to get it. Go ahead and get your 15 minutes of sunlight. With that, I'm going to open it up for questions.
This is great, Dr. Breus. Thank you so much. Oh my gosh. So we're going to pop up a slide for places where you can learn more about and follow Dr. Breus. Here's how you can follow him and learn more about him and all of that. What great information. There's so many great questions coming in now. So in the first question that we have somebody saying, how does napping influence the total number of hours of sleep at night? And we were asking you this before we went on air. So that's a good one.
Absolutely. So one of the things to think through is napping, when to do it and why you're doing it. Number one, most people should not need a nap. I'm sorry to say, I know it's great. You're watching golf, right? Everything's nice and quiet. Boom, you're out like a light. You're watching a game show, something like that. Here's the bottom line here. If you fall asleep halfway through the day, it makes it much more difficult to fall asleep at night. Remember that sleep drive I was talking about? Napping actually reduces it. So nobody should really need a nap. Now, if it's kind of the thing that you have to do, one of the things I tell people all the time is if you got a nap, make it a short one, 25 minutes or less, and somewhere between 1 and 3 in the afternoon appears to be the ideal time to nap, assuming that you're going to bed around 9:30, 10 o'clock.
Perfect. We have a question coming in from Facebook.
Yep.
What strategies reverse beta amyloid plaques?
So it's a great question, and it's not something that we have really good definitive answers for. But on the sleep side of things, well, here's what I can tell you. The more deep sleep that you get, the better that system works. So then the question is, well, Michael, how do I get better deep sleep? Regularity of schedule, so going to bed and waking up at the same time every day, including the weekends, getting yourself treated for a sleep disorder. If you just do those two things, your lymphatic system is going to be moving and grooving exactly the way you want it to be.
Okay, we have a couple questions coming in about waking up in the middle of the night 2 to 4 times to urinate and then having a hard time falling back to sleep, including one person who says, look, I'm on a CPAP machine already, and I still get up a couple times a night to go to the bathroom.
Yep. So complicated question, going to have a few different types of answers here. So number one, if you're male and you're waking up multiple times a night to go to the bathroom, then you got to get your prostate checked. That is definitely what's going on. We see enlarged prostate pushes on the bladder, increases bladder pressure, makes people have to pee in the middle of the night. Number two, if you've done that and your prostate is fine, you should get checked for sleep apnea. We know for a fact that people, an early sign of sleep apnea is waking up to use the restroom in the middle of the night. Now, we also have somebody who's like, wait a second, Michael, I'm on a CPAP and I'm still peeing all night long. What the heck is going on here? So a couple of things you want to think about. Number one, ask your doctor if it's okay to restrict fluids 2 hours before bed. Ask your doctor. I want to be very clear about that. If you have diabetes, you should not be restricting fluids because that can cause even bigger problems. But ask your doctor if you can, because here's what happens. A lot of people will say, well, I didn't get in my water for the day, so it's bedtime, glug, 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 and they try to knock down a couple of glasses of water. I can pretty much guarantee you're going to have to pee. So do yourself a favor. If you can, restrict fluids before you go to bed. Now, the second part of the question, which is one I get all the time, is, well, once I'm up, I'm up. Like, how do I go back to sleep? Like, what's going on there? Okay, so this is going to take a minute for me to explain, but I think you'll get it once I'm there. So first of all, as we're falling asleep, beginning of the night now, our core body temperature rises, rises, rises. It gets to a point and then it falls. That fall is a signal to the brain to release melatonin, right? Then it keeps falling, keeps falling, keeps falling. But at some point in time, it's got to go back north. Otherwise, we go hypothermic, and that's definitely not good. The timing in which it starts to rise again is somewhere between 1 and 3 o'clock in the morning. I'll bet you that's the time that you're waking up, because when your body gets warm, you go into a lighter stage of sleep. So it's easier to wake up. Everybody wakes up during this period of time. However, most people don't remember it because they roll over and they fall back to sleep. So what can you do to just roll over and fall back to sleep? Number one, don't look at the clock. I can't tell you the number of people who look at the clock, they instantly do the mental math and they say, oh crap, it's 3:30 in the morning. I normally wake up at 6:30. Sleep, sleep, sleep. And you try to force yourself to sleep. To be fair, in the history of time, no one has ever thought their way back to sleep. It doesn't work that way, guys. I promise you, it's all about relaxation and your heart rate. Many people don't know it, but you want to get a heart rate below 60 in order to enter into a state of unconsciousness. Great, Michael. How the heck am I supposed to do that? It's 3 o'clock in the morning. I just looked at the clock and now I'm pissed, right? Okay, let me tell you. My favorite technique is called 4-7-8 breathing. It's exactly as it's described. Slowly breathe in for a count of 4, hold for a count of 7, breathe out for a count of 8. Okay, you do about 5 to 7 cycles of that. And it lowers your heart rate almost immediately. So this is a technique that was developed by Dr. Andrew Weil, believe it or not, for Navy snipers. So if you're shooting long range, you try to shoot in between heartbeats because your heart rate can actually change the trajectory of the bullet. And the best way to do that is to lower that heart rate to a 60 or below to allow yourself to make that shot. I'm not saying we're going to have any snipers in the middle of the night, but what I am saying is let's use that technique to our advantage. And it's super easy and it doesn't cost a dime. 4-7-8 breathing. What it does is it allows you to slowly bring in oxygen, utilize that oxygen, then dump out all that excess carbon dioxide. So when you breathe back in, it's much, much easier to breathe in, which lowers your heart rate. The other thing to remember is there's something called non-sleep deep rest. So even if you're lying in bed, lights are out, nothing's going on, believe it or not, that's rejuvenative. It's not like sleep. I want to be clear here, but if you do that for an hour, it's worth about 20 minutes of sleep. So what I tell people all the time is, look, if you're laying in bed for a couple, 3 hours from 3 to 6, believe it or not, you probably got yourself about an hour's worth of sleep. So between the 4-7-8 breathing and the lying quietly, here's what we have a tendency to have happen is that anxiety of looking at that clock starts to go down. And that allows the natural sleep process to take back over. The way sleep really works is on twofold. It's either about discipline or it's about acceptance, okay? Let me explain what I mean. Discipline is all the stuff we've been talking about, right? My 5-step plan, wake up at the same time every day, stop caffeine by 2, stop alcohol 3 hours before bed. That's discipline and that's things that you can do. But I'm gonna be honest with you. Some nights, you're just not gonna sleep that well. I have a 19-year-old daughter and her boyfriend broke up with her a few weeks ago, and I slept like crap after her boyfriend broke up with her. He didn't break up with me, he broke up with her, but he upset her so much, which upset me, and it didn't matter what I did. I'm the sleep doctor, for God's sakes, and I still couldn't sleep well. So there are some things that you just have to accept and say, you know what, my body needs something different than sleep right this particular moment. I'm gonna lie here, I'm gonna relax, allow myself to rejuvenate, but it's okay that I'm not sleeping right now. Because here's the thing, it is, right? Nobody's head popped off because they woke up at 3 o'clock in the morning and didn't go back to sleep. Like it just doesn't work that way, right? And so getting yourself all worked up is not going to do you any good. People say to me, well, but Michael, I've got big plans tomorrow. I'm going out to see my kids or my grandkids, or I'm doing a new activity. Newsflash, you'll still be able to do all of that and probably more. When's the last time that a sleepless night honestly prevented you from doing anything? It's probably been pretty few and far between. So once again, it's about lowering that anxiety, understanding your body, accepting, doing a few things, and seeing how it goes.
That's great. Thank you. I love that. The acceptance. It's hard to get. Okay. I have a couple, I know we're coming to the end, but I have a couple questions I'd really love to get to. Sure. People are asking if sunblock or sunglasses block vitamin D absorption. So
great question. The answer is probably. So being outside for 15 minutes, I would tell people, it's okay for you to remove your sunglasses, but don't stare at the sun. Okay. Like, please just have a conversation with your neighbor or whoever with the sunglasses off for 15, 20 minutes, then throw them back on. I promise you're going to be just fine. Another big question that I get from this population has to do with melatonin. So I thought it'd be okay.
That was my next question. People want to know about taking melatonin pills.
Absolutely. So I'm here to tell you that in this particular population, yes, melatonin may be an appropriate supplement. However, there's a lot of things you need to understand. So number one, 95% of melatonin is sold in an overdosage format, not the right dose. The correct dose is somewhere between 0.5 and 1.5 milligrams. People are taking 3 milligram, 5 milligram, 10 milligram gummies, and they're getting wicked dreams, and it's a problem. The other big problem that nobody is talking about, melatonin is a circadian regulator. So here's what happens. It affects your medication. It could affect your blood pressure medication, your diabetes medication, birth control medication, and mental health medication. Before you go down to the local GNC and buy yourself a big old bottle of melatonin, talk to your doctor and make sure that that melatonin isn't going to change the effectiveness of other medications that you're on. Now, we do know that by around age 55 or 60, melatonin production begins to slow down. So it's not an inappropriate thing for somebody, if you get your melatonin tested and you realize it's deficient, to be on a small dose of melatonin. Again, somewhere between 0.5 and 1.5 milligrams. Also, when to take it turns out to be a big deal. If you're taking the pill or the capsule, you want to take it 90 minutes before lights out. If you're taking it in a dropper, you can take it 30 minutes before because it's sublingual and get up and in much faster.
Wow, that's great. I know we're at the top of the hour. I want to sneak one more quick question in. Sure. Somebody's saying they read that a little protein before bed helps sleep. True?
True. So one of the things that we like to know here is people should not go to bed hungry, but you also shouldn't go to bed with full belly either. So you want to have stopped eating approximately 2 hours before lights out. But if you didn't get in your snacks and your stomach is grumbling, I'm going to tell you, you do want to have a little bit of a snack. My favorite snack at this kind of level is 75% carbohydrate, 25% protein. Carbohydrate, Dr. Breus, are you crazy? That's going to pack on the pounds. Actually, it doesn't. We're talking about a 250 calorie snack here. It's quite small. So what I'm talking about is not complex carbohydrates or processed ones, but simple ones. So an apple with some nut butter would be a perfect little snack, or a rice cake with some avocado, perfect snack before bed. You don't want to fill your belly, but you also don't want it grumbling either. But yes, protein can be helpful, but if you have too much protein, it can be a little bit alerting. So that's why we like to combine it with the carbohydrates. Believe it or not, I stopped eating bagels because they're so dense in carbohydrates. And if I ate them in the morning time, it was like taking a sleeping pill.
That's right. Well, thank you so much. We could keep going. We could keep going for hours, but Dr. Breus and I want to thank you guys all for joining us today. Thank you for all your great questions, and stay tuned for our next webinar to learn more about your third act, finding passion and new purpose in retirement. That's going to be coming up in May. And each of our webinars features a different subject. You can visit brookdale.com/in-the-know to discover more. And we do hope to see you again soon. And until next time, we hope you stay safe, happy, and well. Thank you so much.
Sweet dreams.
That's a good one. Thank you.